You're waking up 3 times a night to pee. Again, your wife's tired, you're exhausted, and every doctor you've seen just shrugs and says, well, you're getting older. But here's what they're not telling you. Those bathroom trips, they're not just inconvenient. They're your prostate screaming for help. And if you ignore it, you're looking at more than just lost sleep. I'm Dr. Jessica Morgan. I've spent 30 years as a urologist specializing in men's health, and I've sat across from thousands of men just like you, good men, strong men, who thought nighttime urination was just part of aging. It's not. Let me tell you about Frank. Frank was 72 when he walked into my clinic in Denver. He looked me straight in the eye and said, "Doc, I haven't slept through the night in 4 years. My wife moved to the guest room. I'm falling asleep at my grandson's baseball games. Is this really just my age?" I hear this question almost every single day, and my answer is always the same. No. This is your body telling you something is wrong. What's really happening down there, here's what most doctors won't take the time to explain. Your prostate sits right underneath your bladder, wrapped around your urethra like a donut. After age 50, that donut starts to grow. We call it benign prostatic hyperplasia, BPH for short. As it grows, it squeezes your urethra. Your bladder has to work harder to push urine through. Over time, the bladder wall thickens, becomes irritable, and starts sending you false alarms. "Empty me," it screams, even when there's barely anything in there. That's why you're standing over the toilet at 2 a.m., waiting, squeezing, hoping, and only a trickle comes out. Sound familiar? Here's the part that keeps me up at night. Most men wait 7 years before they talk to a doctor about this. And by then, the damage is done. The bladder is permanently overstretched. The prostate is pressing so hard that urine backs up into the kidneys. I've seen men end up in the ER with acute urinary retention. That means their bladder is full, screaming, and nothing comes out. We have to insert a catheter. It's painful, it's traumatic, and it's 100% preventable. The sleep connection nobody talks about. Let me ask you something. How do you feel after a night of 3 bathroom trips? Foggy? Irritable? Like you're dragging yourself through the day? There's a reason for that. When you wake up repeatedly, you never reach deep sleep. That's the phase where your body repairs tissue, balances hormones, and clears toxins from your brain. Without it, your risk of heart disease, diabetes, depression, and even dementia skyrockets. One study out of Boston University found that men over 65 who urinate 3 or more times per night have a 40% higher risk of dying within the next 5 years. Let me say that again. Nighttime urination isn't just annoying, it's a survival issue. And yet when I tell men this, I see the same look on their faces. Relief. Because finally, someone is taking them seriously. You deserve to be taken seriously too. Why your doctor hasn't told you this? I'm going to be blunt. Most primary care doctors don't have time to dig into prostate health. You get 12 minutes in the exam room. They check your blood pressure, renew your prescriptions, and send you on your way. If you mention nighttime urination, they'll probably say, don't drink water after 6 p.m., or they'll prescribe a medication like Flomax and call it a day. But here's what they're not telling you. Flomax and drugs like it don't shrink your prostate. They just relax the muscles around it. For some men, that helps. For others, it does nothing. And the side effects? Dizziness, fatigue, retrograde ejaculation, where semen goes backward into your bladder instead of out. Nobody warns you about that part. I had a patient, George, 68 years old. He started Flomax, and within 2 weeks, he couldn't perform sexually. He didn't connect the dots until he came back to see me, embarrassed and frustrated. "Why didn't anyone tell me this could happen?" he asked. I didn't have a good answer, except that we've normalized medicating symptoms without addressing the root cause. And that's exactly what I want to change. The 3-minute evening routine that changed everything. Now, I promised you something practical, something you can start tonight. This routine isn't complicated, it doesn't require pills, and my patients swear by it. Here's what you do. Step 1, the hydration shift. Stop drinking fluids 2 hours before bed. I know, you've heard this before, but here's the key. Front-load your water intake. Drink most of your water before 3 p.m. Your body needs hydration, just not right before sleep. Step 2, the double void. Right before bed, empty your bladder. Wait 30 seconds, then try again. This technique, called double voiding, helps you fully drain your bladder so it's not sending false alarms 2 hours later. Step 3. Elevate your legs. For 20 minutes before bed, lie down and prop your legs up on pillows. This helps fluid that's pooled in your legs during the day get filtered by your kidneys before you go to sleep, not at 3 a.m. Frank, the man I told you about earlier, he started this routine. Within 10 days, he went from 4 bathroom trips a night to one. His wife moved back into their bedroom. He started waking up clear-headed. He told me it felt like he'd gotten his life back. But here's the thing I haven't told you yet. The hidden danger lurking in your medicine cabinet. Even if you do everything right, hydration, double voiding, leg elevation, there's one silent saboteur that could be undoing all of it. Your medications. Diuretics, blood pressure pills, antihistamines, antidepressants. Many of them make urination worse. Some make you pee more. Others make it harder to empty your bladder fully. I can't tell you how many times I've reviewed a patient's medication list and found 3 or 4 drugs all working against his prostate. And here's the kicker. Most men don't even know. So here's what I want you to do. Make a list of every medication and supplement you take. Bring it to your doctor. Ask point blank, could any of these be making my nighttime urination worse? If they brush you off, find a new doctor. You deserve someone who listens. What about surgery? I know what you're thinking. Doc, should I just get surgery and be done with it? Maybe, but not yet. Surgery, whether it's a TURP, laser procedure, or Urolift, can help. I've performed hundreds of these, but they come with risks. Infection, bleeding, sexual side effects, incontinence. And here's what nobody tells you. Surgery doesn't stop your prostate from growing back. I've had men go under the knife, feel great for 2 years, and then the symptoms return. Because the underlying issue, hormonal changes, inflammation, lifestyle, was never addressed. That's why I always start with the conservative stuff first. The routine I just gave you. Pelvic floor exercises, dietary changes, stress reduction. If those don't work after 3 months, then we talk about medication or procedures. But you owe it to yourself to try the simple stuff first. The one thing I want you to remember, listen, I know this isn't easy to talk about. Men aren't supposed to admit when their bodies aren't working right. You're supposed to be tough, to push through. But pushing through doesn't make you strong. It makes you sick. I've sat with men in their 70s and 80s who told me they wish they'd spoken up sooner, who wish they'd asked for help before their bladder was damaged, before their marriages suffered, before they lost years of good sleep. Don't be that guy. You're not broken. You're not weak. You're dealing with a medical condition that has real, effective solutions, and you don't have to do it alone. Here's what I want you to do tonight. Try the 3-minute routine. Hydration shift, double void, elevate your legs. Do it for 1 week. Keep track of how many times you wake up. I think you're going to be surprised. And if you want to go deeper, if you want to understand what's happening with your PSA, your testosterone, your prostate size, stay with me. I'm going to keep making these videos because I believe you deserve honest answers. Hit that subscribe button because next week, I'm going to share the one blood test your doctor probably isn't running and why it might be the most important thing you do this year. Take care of yourself. You've earned it.